Morning guys, well it's afternoon now. Just finished morning clinic. 2 new patients. One, we agreed that testosterone replacement therapy was the best option for him, and one where we agreed that testosterone replacement therapy wasn't the best option. So what's the difference between this and going to a provider? Isn't it funny? Testosterone deficiency syndrome is a medical condition. However, there are more bros involved in treating TRT than there are doctors, which is very disappointing. Now, it's not the fault of the bros, because the bros are just trying to make some cash, you know, and dare I say the shortcomings in the care and knowledge delivered by the NHS is shocking. So there's no wonder that guys have thought, yeah, I can make some cash out of this, and I can also try and pretend it's in the patient's best interests, because, you know, perhaps it is, perhaps it isn't, they don't really care, they're just trying to sell you drugs. Now, they will say that they are acting in your best interests, but if they're not delivering a personalised care, then they're not. If you're not seeing a doctor, they're not. If they are not medically qualified, they are not. Because they don't understand what's involved in delivering a high quality medical service. They are patients. They are bros. They are people that are essentially using the shortcomings in the NHS and also private sector, unfortunately, as an opportunity to make money. So when you talk about your provider, it rings alarm bells, because you should be talking about your doctor. You should have direct contact with your doctor. Testosterone deficiency syndrome should be managed by your doctor. Are we starting to understand? Because we get numerous, loads of inquiries from people that have been to providers who have been very uncomfortable with the information that they have been given. Some of them have been with the provider for a number of months and realised that it wasn't the service that they were promised. Some of them have just simply had a blood test and gone, this doesn't seem right. Some of them literally just had a phone call and said, it sounds like a sales pitch. Well, it is a sales pitch because they are salespeople. They are not medical professionals. They are not working in your best interests. They are literally selling you drugs under the premise of optimizing your hormones. They don't even understand what optimizing is. Jeez, you know, it's one of my biggest bugbears. We are trying to legitimize testosterone deficiency syndrome. We are trying to set the standard when it comes to TRT. Now, what have we got? Plonkers everywhere trying to make some cash. If we want testosterone replacement therapy accepted by mainstream healthcare system, we need doctors to be involved in delivering care. What's harming that is providers providing care, because unfortunately they're doing it wrong. You know, TRT on the face of it seems quite simple. Replace the testosterone, replace the LH with HCG. Simples. It's far more complicated than that, unfortunately. You know, I'm not going to go into the details because that's a long conversation, but People that are on testosterone replacement therapy and people who are optimized understand it's a journey. It isn't simply a wham bam, thank you ma'am. This is not a sales consumer relationship. This is a doctor patient relationship. The message will get through because we will fight for your right to have decent access to decent services. So yeah, don't worry, we've got your back. We will continue to fight the good fight, and we will strive to allow everybody to have safe and effective care delivered by a doctor.